First, I'll introduce myself to my patient. Hi, my name is Kate. I'm going to be your nurse today. Could you please verify your name and date of birth for me? All right, thank you. Do you have any allergies that I need to be aware of? Okay, and then I will explain my procedure to the patient. I'll let them know that I am going to be changing out their dressing for today. I then would ask them to rate their pain on a scale from 0 to 10, 0 being no pain, 10 being the most pain you can imagine. If they don't have any pain, then that's good, but if they did, then I would administer pain medicine 30 to 60 minutes before changing out their dressing. I then will gather my equipment. I will get my sterile field, sterile 4x4 gauze, Q-tips, NS solution, ABD pad, tape, pin, measuring device, trash can, and red bag. I then will go to my patient's bed and I will raise it above waist level. And I will go ahead and position my red bag and cuff it for later use. I then will go ahead and I will perform hand hygiene, and I will put on a clean pair of gloves. I will go ahead and put my measuring device in place for later use, and I will position my patient and I will drape my patient. Okay, now I will begin to take off my patient's old dressing. When I am taking off the dressing, I will note drainage, color, amount, and if there was any odor. I then would assess the wound. I would assess the wound bed color, the coloring of the skin around the wound edges, the closure of the wound, and if there were any drains present. I then will dispose of my soiled equipment, and I will perform hand hygiene. Now I am ready to set up my sterile field above waist level. I then will pour my sterile solution, making sure not to splash. And I will maintain sterility of all sterile items. Now I am ready to put on my sterile gloves. Now I am ready to clean my patient's wound. I will take a moist 4x4 gauze and I will clean from areas of most contamination, from least contamination to most contamination, making sure to use one gauze per stroke. Now I will measure my patient's wound. I will use a moistened, sterile Q-tip, and I will measure for tunneling, and I will also measure the length, the width, and the depth. Nine centimeters for the length, 3 for the width, and 2 for the depth. And I'm going to make sure to maintain sterility and make sure not to contaminate. Now I'm ready to pack my wound. I will take moistened 4x4 gauze and I will wring out any excess. I then will fluff my gauze and take a Q-tip and I will pack my patient's wound in any tunnels, and I will make sure not to contaminate. Now I will place a dry 4x4 across my patient's wound, and I will place a sterile ABD pad. Now I will remove my gloves and I will go ahead and tape all 4 sides . I then will date, initial, and time my piece of tape. And place it on the ABD pad. Next, I will lower my patient's bed. and I will put my patient's call light within reach. Now I will apply another pair of gloves. And I will dispose and clean up my area. I will take the red bag out of the room and clean up all my equipment. Then I will remove and dispose of my gloves. I will perform hand hygiene, and now I am ready to document. Whenever I am documenting, I will document in the EHR, and I will document if there was any drainage, the color, the amount, if there was an odor. I would also document the assessment of the wound, the color of the wound bed, the skin around the wound edges, the closure, and if there were any drains present. I would note any cleansing, the kind of dressing I did. I would note that I put one 4x4 gauze with a dry 4x4 over, and then as well as my ABD pad. I would note how my patient tolerated the procedure, and that is it.